Hi, I'm Dr. Raphi Wald, Palm Beach Psychology Associates, and today I'm going to be talking about obsessive-compulsive disorder. Obsessive-compulsive disorder, or OCD, is one of the most commonly self-diagnosed psychiatric problems. That and, I would say, ADHD are the two most commonly self-diagnosed problems. You hear people all the time saying, oh, I have OCD, or my friend has OCD. Well, I'd like to tell you a little bit about exactly what OCD really is, and what it's made up of are both obsessions and compulsions. What obsessions are thoughts that people have in their heads that they have a hard time getting out. So they kind of become overly focused on things, and they find themselves unable to start thinking about other things. And very common obsessions include obsessions over contamination, for example. People might think that they are contaminated when they touch things in the bathroom, for example. And then there's compulsions, which are the other side of OCD. And compulsions are actions that a person takes in response to obsessions in order to relieve their obsessions. Sometimes these compulsions are related in some kind of a meaningful way to the obsessions, and sometimes they're completely unrelated. So for example, going back to my earlier example about obsessions where a person might be afraid that they've become contaminated when they go into a bathroom, so a rational way to deal with that fear might be to wash your hands 25 times a day. And people who have that kind of a problem tend to have very chapped hands. Sometimes they even bleed out of their hands, and they can make themselves susceptible to infection. And then sometimes respond by doing irrational compulsion. So for example, a person might say to themselves, oh, if I tap this desk 100 times before I leave the room, then I won't become contaminated. So they'll sit and they'll tap the desk 100 times. And other common compulsions and obsessions are, people can worry about their families. People can obsess about the safety of their home. And people respond to these compulsions in a lot of other ways as well. So for example, a person might have a check-in compulsion. So they go back into their home over and over again in order to check to make sure they turn the oven off or to make sure that they locked all the doors. We treat OCD also through cognitive behavioral therapy, just like we treat depression, except it has a different focus. It's called ERP, which is exposure with response prevention. So it can be somewhat of an uncomfortable process for a person with OCD because your psychologist is going to expose you to that thing that makes you uncomfortable. So for example, if you are uncomfortable in bathrooms and touching handles in bathrooms, your psychologist is going to bring you in there and keep you calm through the process of being exposed to those handles. In addition, there are medications that help. If talk therapy alone doesn't help, there are medications that can help. Usually these are antidepressant medications, and there are other medications that are sometimes used, which are anti-anxiety medications. And that generally is OCD and how we treat it.